dealing with the missing teeth, either partially missing teeth or completely dentulous mouth in elderly is some of the common things which we come across.
So what I also want to know is what are the special care, if at all, if any, and what are the special considerations we should think and then proceed before we start?
Because these elderly patients also have absorption problem. They cannot absorb the essential minerals and hence they suffer from nutritional deficiencies.
Yes.
So we need to find out all the problems that person is facing, including the cognitive dysfunction,
Yes.
the thinking issues which happens with such patient due to Hello everyone, greetings from HSR Dental Clinic and Implant Center. I am your host, I'll say, Professor Dr. Deepak Daryani, and we named this podcast as Dental Podcast by Professor Dr. Deepak Daryani. Today, the topic of this podcast is Geriatric Dentistry, which is related to elderly people. And with me, as usual, is my host,
Yes.
Dr. Rupanjan. Hi, Dr. Rupanjan.
Hello.
Welcome to this podcast.
Thank you so much.
Let's start with the
Yes.
session and try to give as much information as possible
Yes.
in a simplistic manner.
Yes. So welcome everyone, greetings of the day. As Dr. Deepak already told that we would be dealing today with geriatric dentistry. So my first question will be to you is, what do we understand by the term geriatric dentistry?
Here the word geriatric, as we all can anticipate,
Yes.
it means dentistry related to elderly people.
Yes.
Okay. So we have males and females. Both come with different set of problem.
Yes.
There are certain problems which are very common. For example, patients suffering from diabetes, maybe controlled or uncontrolled, hypertension, which are the most common problems. Okay? Hypertension or coronary artery disease and diabetes. Apart from that, there are certain other problems like other systemic diseases,
Okay.
post radiotherapy complications. In women, we see a lot of post menopausal complication related to oral cavity, and we see periodontitis as a very common problem in the elderly, which leads to bone loss and which leads to teeth falling down. So dealing with the missing teeth, either partially missing teeth or completely dentulous mouth in elderly is some of the common things which we come across in the geriatric dentistry. Now, one important point is how it is different from any other
Yes.
thing. It is very different. An elderly is not having that kind of energy as a young one. So, and they are suffering from various type of systemic diseases. They are on various medications. So we have to see their problems and adjust as per their needs. The adjustment can be in terms of the timing of the procedure we do, the duration, the timing of the day when they would like it. It also depends upon the medication they are having. For example, many of the heart related disease, they are on blood thinners, so we cannot do various procedures. And even if we do, we have to do with certain precautions. In sometimes we have to modify the way we treat the patients. So basically geriatric dentistry is a customized dentistry related to that particular elderly person.
Yes.
We customize the way we give the procedure, the time duration, the medicines which we give, it should not interact with the drugs which they are already taking.
Yes.
So taking care of a elderly person in a customizable way is how will I describe
Yes,
geriatric
geriatric
dentistry.
Yeah, thank you so much, sir, for the introduction. And what I would like to ask is, now what do we understand by the term geriatric dentistry, or which all population is catered to in geriatric dentistry?
Yeah, so as the term implies, geriatric means elderly population. So it is related to elderly. Now, what are the common problems which an elderly population faces? Diabetes,
Yes.
hypertension, most common problems. Because of this, they are taking certain medications.
Okay.
In diabetes, the blood sugar fluctuates. So customizing the dental treatment, the duration of the dental treatment, the timing of the day when we are doing it, giving them the medicine which suits them and doesn't interact with the medications they are taking,
Yes.
very, very important. The other certain symptoms are other systemic diseases. For example, post radiotherapy, patients who have suffered from cancer and have done radiotherapy,
Yes.
we are customizing the treatment as per them. We know that the bone density decreases.
Yes.
What is known as the osteoradionecrosis happens in patients with radiotherapy. So customizing the dental treatment for them. In the elderly women, due to the postmenopausal situations,
Yes.
they face various problems like burning mouth, burning in the tongue, dysgeusia or altered taste sensation, dry mouth. So customizing the dental treatment as per them and managing these symptoms of dry mouth, burning sensation also comes under geriatric dentistry.
Okay.
So basically it means customizing the treatment of an elderly person as per their situations, what are they going through, what are the medications they are taking, and how much of the treatment they can tolerate.
Yes.
So we customize, and this is what I will define as geriatric dentistry.
So what I also want to know is, what are the special care, if at all, if any, and what are the special considerations we should think and then proceed before we start treating a geriatric patient?
Very good question. I will answer it by saying it depends upon the type of patient.
Yes.
Let's say a diabetic patient has come. Okay, so diabetic patient is taking medication. We will ask whether he's taken medication, what are his blood sugar level fluctuations. If he requires extraction, whether we can do, what are the investigations to be done.
Yes.
After extraction, what we can expect. Is there any other surgeries to be done, and what can be the outcome depending upon what is the maintenance of glucose level in such patient.
Yes.
When we are giving medications, are they interacting with them? The other most common problem is heart related problem, the coronary artery diseases, the biggest killer in this world.
Yes.
So patients are under certain medications. Are they taking statins for cholesterol, which leads to muscle pain? Are they taking blood thinners, which will increase the chances of bleeding? And if we do the clotting time and bleeding time and find that they are uncontrolled, we may change instead of extraction, we may go for a root canal.
Yes.
So, and if we have to do an extraction or surgery, we prepare ourselves. We call the patient at a certain time of the day. The maxillofacial surgeon and team of the specialist dentist will make sure that we are equipped with situation where a problem can come and we can tackle the situation. So all these things needs to be taken care of.
Yeah.
One more important thing I will talk about is the postmenopausal symptoms dealt by elderly women.
Yes.
So this is a very common problem which goes unnoticed in the society, and women feels that they have to live with it. The problems are dry mouth, burning sensation, dryness in the tongue, balding of the tongue, ulcers in the oral cavity. So we need to find out by doing various blood investigation what problems they are having, and we can give certain medicines, topical or systemic, to cure them. Right? Another set of problem is with people who have undergone radiotherapy after the cancer, and their bone undergoes osteoradionecrosis. So we have to be very careful with them. We don't suggest them more x-rays. We don't do surgical procedures because healing cannot take place because there is not enough blood supply. So these are the common things which comes under geriatric dentistry.
Okay.
And basically in geriatric dentistry, we do kind of a palliative treatment rather than definitive treatment. Okay. Looking at their situation. If the patient is wheelchair bound, we have to have a dental chair which can accommodate wheelchair.
Yes.
We may be able to do the treatment in the wheelchair of the patient. Sometimes patients are non-ambulatory and ambulance comes and we have to manage with that. So these are some of the things we should be ready with if we are dealing with the geriatric dentistry patients.
Okay. Now, also, I would just like to know one thing, that in all the different specialities we have, as in you told about root canals or extractions, how we go ahead exactly and what are the things we modify on a geriatric patient depending upon the different specialities? How we can modify our treatments depending upon the particular problem the patient has, and definitely in a geriatric case.
So let's say a patient has come with the root stumps.
Yes.
It's a grossly decayed tooth. We did her checkup. We found her drug history and we found that patient is taking blood thinners. Now, if we go about extracting that root stumps, we may do a lot of harm and patient may not be able to take it if it's in a very weak stage.
Okay.
And if the patient tooth is paining, we might as well do a root canal there. Remove the infection without giving any macro trauma, because the root canal is a microsurgical process. There is not much of bleeding we can easily control. And with the help of antibiotics, we can totally avoid the surgery itself.
Okay.
Right? Now, let's see a compromised patient, elderly, has come with edentulous mouth. He says that he's not happy with the denture. The answer is the full mouth implants and giving a fixed prosthesis, right? But patient may not be able to take the load. So rather than that, we can give an implant supported denture. He's wearing a denture. We just give one or two implants or 4 implants, and on that we can put a denture instead of doing the full mouth rehab.
Yes.
So the patient may be able to save a lot of time, money and energy in that. So what I'm trying to say is, we don't go for the ideal treatment.
Yes.
We go for the treatment which that patient can manage. Okay, in terms of his time, money and energy. Okay, so that is what I say is, we try to do a palliative treatment as compared to a definitive treatment in a geriatric patients. And like that, there are so many.
Yes.
So I would also like to put here a point on the elderly women, which I also talked about.
Yes.
If it's a postmenopausal symptom and patient is suffering from dry mouth or dysgeusia or burning sensation in the tongue, that is called as burning mouth syndrome.
Okay.
We know very less about it, but we know some things. The evidence says that we can do blood investigation, get a referral from the gynecologist, find out what are the hormone levels, what are the deficiencies patient is suffering from, because these elderly patients also have absorption problem. They cannot absorb the essential minerals and hence they suffer from nutritional deficiencies.
Yes.
So we need to find out all the problems that person is facing, including the cognitive dysfunction, the thinking issues which happens with such patient due to changes in the hormones. So we do a holistic approach here, do the investigation. If there are nutritional deficiencies, we correct them. We give them medicine as per their symptoms, and we also do cognitive behavioral therapy if it's required, and try to manage the patient in a holistic manner. I will say that that's how we go about treating the geriatric cases. I think that will answer most of the common questions.
Almost all the aspects of geriatric dentistry and how we go ahead and deal with them. You have almost covered everything in a nutshell.
And I will ask you one thing, doctor, like from the periodontist point of view. See, diabetes is one of the most common chronic diseases existing in the society.
Yes.
What are the common features of diabetes in the oral cavity? Gum related issue, bone related issue, halitosis.
Yes.
Okay. In such patient, especially ones which are compromised, what is the role of maintaining the oral hygiene in such cases?
Yes. How
can we manage such cases? How can we increase the life of teeth in such patients?
Yes. As we all know that diabetes is one of the now in India, out of 10, 8 to 9 people are diabetic. Nowadays, this is not considered as a disease, it's a part of the society. But we also have to understand that diabetes comes with stress. The more and more stress build up, diabetes is a factor, and that has direct implications in the oral cavity. The moment we see a oral cavity, we can appreciate inflamed gums, we can appreciate bleeding gums, we can appreciate ulcers forming all around, which are classical signs that the patient is a diabetic patient. Now, as we are talking and dealing about the geriatric dentistry in particular, what happens as age advances, the ability to brush all the areas reduces drastically. Also, the wish to do it reduces, because as we are young, we have a tendency to feel fresh, to have a very good breath. That falls down as we age. The natural stimulus doesn't come, so we don't brush all the areas properly as age advances. Also, if we see our grandparents, they have a habit of using substitutes as compared to a toothbrush, maybe the fingers, maybe the neem, datuns, all those things. However, nothing can substitute a toothbrush and the right technique of brushing. So first thing I would like to say is the reduced brushing efficacy is where all the problem starts. Second is various practices in the, maybe we can see in the rural areas, using various leaf extracts or chemicals to do the brushing. Now, when we are doing the brushing with those, there are multiple aberrations and erosions which we see in mostly in the elderly patients, where they complain of a severe sensitivity, which needs to be again dealt with on a holistic approach. Third is, now for example, if the diabetes is uncontrolled, first and foremost, we have to go about maintaining the oral hygiene every 3 to 4 months. That is a routine cleanup, because since the brushing is inadequate, a professional dental care will substitute for the inadequate brushing to some extent. I will not say that it can substitute 100%, but to some extent it will substitute that. It will help maintain all the areas in a much better way. And mouthwash, because your brush can't reach all the areas where your mouthwash can go, specifically in the margins below the gums. Use of a mouthwash, and to some extent a lukewarm salt water rinse. These are the basic at-home practices, and a professional 3 to 4 months thorough dental examination, thorough dental cleaning, and teaching them the right technique to brush and motivating them the reason to brush is what I feel will help us in maintaining or treating a geriatric patient with a much better approach and a much better care and maintenance.
Older patients also are immunodeficient.
Yes.
They are having systemic diseases, they are immunodeficient. Upon that, they are not able to maintain oral hygiene. So what happens? There's more bacterial accumulation and immunological tolerance is low.
Yes.
So the infection spreads very fast.
Very rapidly, yes.
So we need to have on routine basis antibiotic mouthwashes to be used. As you said, salt water rinses, which also is also an antibiotic mouthwash which flushes out the food, but also bring down the bacterial load, which is extremely important when it comes to taking care of a geriatric patient. Periodontium, that is the structure which holds the tooth, so that the teeth is there for a longer period of time. So doctor, I also wanted to ask, using this chlorhexidine, like one of the best antibiotic mouthwash is what is said, can we replace a salt water rinse with a sodium hypochlorite, whether it is more effective, or what is the evidence, or can we just using the sodium salt water rinses? Or if an elderly should use mandatorily an antibiotic mouthwash, or he can just manage with salt water rinses, how they can maintain in a simplistic manner?
Yes. So to answer that, let me first tell, if a geriatric patient is having no systemic implication, that means no cardiovascular concerns, no diabetic concerns, no hypertensive conditions, and where there is no altered saliva flow or there is no burning mouth, no complaints, the patient is well and fine, we can just go ahead and use a salt water rinse every day, 2 times a day. One in the morning after brushing, and once before you go to bed at night. I would highly recommend that after you do the salt water rinse at night, to not have anything, so that the effect of that antibiotic salt water rinse stays there for the full night and helps in a much more microbial load reduction. But however, this is not sufficient in case when there is some added systemic concerns. However, in case of diabetics, in case of hypertension, when they are on other medications, the medications which are known to suppress the salivary flow, in all those scenarios, routine salt water rinses will not help on a larger front. So what we tell is to use of a chlorhexidine based mouthwash. Now when we tell a chlorhexidine based mouthwash, the first thing to note is it should be alcohol free. Second is it should be used diluted. It should never be used undiluted, because with some patients there can be chances of burning mouth with undiluted mouthwashes. So it should always mention 1:1 dilution with water and 1 part mouthwash, and that has to be used half an hour after brushing. So this time frame is very important to note, because sometimes what happens, the contents of the mouthwash, which is the chlorhexidine, reacts with the contents of the toothpaste, causing a staining intensity. So these mouthwashes also, what I suggest is to not use for a prolonged period of time. So once they visit us, we examine the patients properly, we recommend a particular type of mouthwash, and that to be used for a period of 15 to 20 days as recommended by the gum specialist or the dentist in particular. However, if there is any periodontal inflammation, any periodontal surgery is being performed, or the gum procedures being performed, routine chlorhexidine mouthwash can be substituted with a much better quality mouthwash, and which is basically the octanidine mouthwashes. Now these mouthwashes helps in a much more microbial load reduction and maintenance for a longer period of time. So don't just go, what I suggest is don't just go and start using any mouthwash. Ask your dentist in particular or your gum specialist which mouthwash to be used, until how long it should be used and what is the duration of use. And salt water rinse without any complications. Just use it every day for a better oral life and a better approach to oral health.
With that, we covered most of the points which we think will come under geriatric dentistry, as this population is usually ignored. So senior citizens, whoever is listening, I hope that we were able to give some insight into their issues and how we go about doing it, and how it should be managed, how their problem should be managed in the evidence-based manner, and causing minimal damage or complications to them. So with this, I think we will call this session an end. Thank you so much, Dr. Vanj. It was a useful session for all the listeners. I request them to please give a feedback. How did they like this episode? Were the information given useful? Were they able to understand the situation? What they couldn't understand, and how we should go about doing it so that it is helpful for all of you. If you have any doubts or queries, please contact us. Our contact details are there in the screen. Please feel free to contact us, and our front desk will help you with any of your queries. So thank you all so much. Namaskar. See you again very soon. Bye-bye.